Thank you so much, Aiden, for that introduction, and happy Halloween. We are in the spirit today. We're going to be highlighting a little bit of what the Two-Spirit Dry Lab does, and then featuring some preliminary results from the Sex Now survey. But before going further, we wish to acknowledge the ancestral, traditional, and unceded territories of the Coast Salish people, in particular the Squamish, Musqueam, and Tsleil-Waututh First Nations, on whose territory we meet today. I'm a settler of German, English, and Irish ancestry, and born on land previously occupied by the Lenape people just outside what we would refer to as Philadelphia, and an uninvited person to the land of the Coast Salish people.
Danse, nechatimchik Harlan Pruden, ewaka no mani niha ayakwe. Greetings, my relatives. My mun doesn't have that, the hat doesn't sit well. Thank you so much, Ryan, for that beautiful land acknowledgement. The land acknowledgement I'd like to own of, I too am a visitor and a guest. I've gone through the various protocols of contacting each of the protocol offices and asked if I could be a guest in and on their territory, just like Ryan is a visitor to this territory. And so for him modeling that, of what does it mean when we do this land acknowledgement? If I didn't do this land acknowledgement, I run the risk of, or kind of the analogy that I use is if for me to walk into your house and not acknowledging that I'm in your house, and if we carry that analogy forward, I'd start telling you how and when to live in your own home. So that's not what I want to do. This land acknowledgement also roots and grounds me, and it also reminds me, and as a constant reminder, that I'm an ambassador. If I do not carry myself in an honorable way and a good way, is that the Coast Salish and my Coast Salish relatives would think nasty things of Harlan. But then I run the risk that people will think nasty things about my Cree people. And so in that respect, I show up as an ambassador for my people. And we all have people. Your people show up in the rooms before you show up in the rooms. So we must remember, who do we embody and who do we represent? Because if you do not carry yourself in a good way, I'm going to make assessments not only of you, but I'm going to make some assessments and judgments about your people that you are representing and you are being an ambassador for. So with that, that's our land acknowledgement. A little bit of background and context. In the area of truth and reconciliation, rarely are Two-Spirit and native GBMSM folks are included in research projects that center our experiences and our ways. There is a collective responsibility to center Indigenous peoples and communities in health research. One, because we have health. And two, for this presentation, as well as the work for members of the Two-Spirit Dry Lab, it responds and is an embodiment and breathing life into the calls to action, and specifically the 18th, 19th, and 20th calls to action. 18 being recognized in implementing healthcare rights for Indigenous people, and also measurable goals to identify and closing those gaps. And the 20th one is looking at the distinct health needs of Indigenous peoples here on this land and this territory. These are members of the Two-Spirit Dry Lab. Aiden, yay. Jenny, is Jenny in the room right now? Myself, Ryan, and Travis Sawe. Travis, are you here? And our camera shy member, Teddy. So what I did was I Googled cutest kitten picture, and this is what popped up from Google search. And so that's what is a placeholder for Teddy. How, as the Two-Spirit Dry Lab, and why we call ourselves the Two-Spirit Dry Lab. And I think that we're the only right now and the first research team that works with and for the Two-Spirit community. And we're also, we consider ourselves a dry lab because we don't have beakers, So that's why we're a dry lab. We don't deal with anything liquid, just the realms of ideas. For our commitment as members of the Two-Spirit Dry Lab is that we center Indigenous ways of being and of that community. We are transdisciplinary, and we work finding those spaces that is bringing all of our disciplines to the table, and then we try to find that tween space. It is through collaboration of Indigenous and non-Indigenous epidemiologists, researchers, as well as community members and voices. And we also root and work within Indigenous methodologies as well as approaches, meaning we focus on taking a two-eyed seeing approach. With one eye, what we do is we center and look at Western epistemologies and methodologies, and with the other eyes, we take an Indigenous approach to those same sort of conversations. We do not betray either. We hold both spaces at the same time as we view and look at information. And our meetings and work is done in a circle. And what we mean by working in a circle is that it's collaborative and it is non-hierarchical. We're asking for people's humanity at the table, a part of our research team, and for them to show up and be people first and to offer their gifts, their medicines, as well as their purposes, what they have into coming up with the questions, as well as where do we focus the work.
So Sex Now, often referred to as the Gay Census, is Canada's largest and longest running national periodic survey of GBTQ2 men's health, run by the Community-Based Research Center. As you can see, the Sex Now survey has gone from a paper-based provincial questionnaire filled out at Pride events to a national survey administered both online and in person, both in French and English. For example, of the growth, the 2014-15 cycle captured over 8,000 respondents. From a health equity perspective, Sex Now addresses the lack of national data on health of GBTQ men and has more recently been expanded to capture 2S individuals.
So for the Two-Spirit Dry Lab, we founded and we started working with the 2014-2015 data set of Sex Now. And there were questions that we were asking of the data, but because the survey instrument didn't ask the questions, we were blind to what was going on. And so what the Two-Spirit Dry Lab did was we prepared a report, and we presented that to the principal investigators of these are things that we would like to see within the survey instrument. And so there were Indigenous-only responses, plus how we collected the information of Two-Spirit and who was Two-Spirit. In the 2014, there were folks who were non-Indigenous that selected into, and we couldn't use that data or those responses. The principal investigator, Nate, accepted all of our recommendations, and so we look at how the 2018 and the soon-to-be 2019 online survey. And for us is generosity must be met with generosity, and that was a total act of generosity in looking at the survey instrument. So I said to Nate, how can I make sure that our community is participating, my community is participating within the 2018 in-person survey and soon to be the 2019 online survey. And so Nate said, could you help do recruitment? And I said, absolutely. And so I attended 6 different prides: Winnipeg, Vancouver, Edmonton, Calgary, Kamloops, I think New West. Anyway, last summer, I was so full of pride, my cuticles had pride. But it was within that that it totally impacted who was participating within the 2019 in-person survey.
So now to get to the honey part. The Sex Now 2018 survey thus far was an in-person cross-sectional mental and sexual health survey among men between men, whether cis, trans, or 2S identified. Recruitment was conducted at Pride festivals in 15 cities across Canada, as Harlan mentioned, between June and September 2018. Eligible participants had to live in Canada, be at least 16 years of age, and identify as a man, again, cis, trans, or 2S, or who was 2S GBTQ identified, or who had had sex with another man in the past 5 years. Participants completed an anonymous survey including questions about demographics, having a family doctor, sexually transmitted infection, STI, or HIV testing. and accessing mental health supports, either psychiatrists, counselors, or social workers. Again, we use the two-eye seeing approach in the descriptive analysis, examining access to both traditional and Western forms of healthcare and healing. From an Indigenous perspective, this might be consulting an elder, a knowledge keeper, a participant in a sweat lodge. These are but a few recent innovations to the survey led by the lab. So of the 3,524 participants in the Sex Now survey so far in person, 9% identified as Indigenous, and almost half of that group identified as Two-Spirit, 42%. The proportion of Aboriginal respondents, 9% in the 2018 Sex Now survey, compares, again, which was alluded to earlier as an oversample, where the national average reported either in 2011 or 2015 is roughly under 5% by Statistics Canada. So some would position these results as oversampling, but we would say that this is doing good research, as it is a community-based sample, and that more research prioritizing TUIS individuals, both in survey and qualitative research, should be done. So our study is therefore a call to action for researchers as a viable model for doing this good research. Among Indigenous respondents, 61% had a family doctor, 40% accessed mental health supports in the past year, and 11 and 10% indicated never having tested before for STIs or HIV, respectively. Using the two-eyed seeing approach, we acknowledge the importance of culturally specific health-seeking behaviors and practices of Indigenous participants. So we find that 20% had access to elder in the past year for health-seeking knowledge, 11% access to knowledge keeper, and 9% access to sweat lodge. Oh, were we? So those are our results. A little bit about the projects we're engaged with. Harlan and I looked at a 2-year prep knowledge translation gap across BC and wrote about that. We also have work in the Lancet, which Harlan will briefly mention.
So right now, the Two-Spirit Dry Lab is working on an article for the Lancet, and it's looking at some of the results of looking at the drivers of sexual health knowledge. If you were at last year's conference, we presented some of those findings. We are working on Saturday. Representatives of the Two-Spirit Dry Lab are going to go to the American Public Health Association's annual meeting and expo in Philadelphia. We have 3 orals. But more importantly is we're meeting with the 2 caucus chairs of the LGBT Queer Caucus, the chair, and the Indigenous Caucus. And what we're going to do is be laying the groundwork for 2020. Both of those caucuses we have a tentative commitment that they're going to surrender scientific time so that we don't have to go through the peer review process, and that we can actually program it for the 2020. And it'll be the intersectionality of those 2 caucuses in developing and creating a space for Two-Spirit and looking at Two-Spirit health within a public health sphere. We also submitted a grant to the Canadian Institute for Health Research, and it is the Indigenous Wellness and Gender Initiative. And fingers crossed, legs crossed that we get that grant. It'll be beautiful. And CIHR has also been leaning in really hard in not only doing a dedicated funding call that looks at the intersectionality of indigeneity and gender, but they've also been incredibly on the forefront of not demanding that a principal investigator must have an academic post within the academy, that community members like myself can be as a principal investigator. And it did cause my institution a little bit of flummox. They wanted to have an Indigenous person, an academically affiliated person from UBC to serve as the principal investigator, putting all of the power on how the work is being done, what work should be done as a member of the academy. And so we have a workaround, and if we do get that grant, it'll be something that will be great for looking at health and well-being. And we're going to go.
So thank you, Harlan and Ryan.
Thank you.